Pylephlebitis as a complication of diverticulitis. Definition. Pylephlebitis is an infective suppurative thrombosis of the portal vein or its branches, and it's typically associated with intra-abdominal infections such as diverticulitis. The portal system drains blood from the abdominal section. It begins with thrombophlebitis of veins draining an area of infection, and the extension leads to septic thrombophlebitis of the portal vein, which can involve the mesenteric veins, and this can lead to bowel ischemia, infarctions, and death.
Although the cause is unknown, diverticulosis is associated with a low-fiber diet, constipation, and frequent straining with bowel movements. Constipation causes increased pressure inside your colon. Increased pressure may cause the mucosa and submucosa to herniate through a weakened area of the wall of your colon and form a diverticulum. Diverticulosis occurs when you have these diverticula, but often no other symptoms. In contrast, diverticulitis occurs when the diverticula become inflamed. The usual symptoms of diverticulitis are lower left abdominal pain, fever, constipation or diarrhea, and decreased appetite. Diverticulitis may develop an accumulation of pus called an abscess. Excessive swelling and accumulation of pus may lead to the formation of a perforation, allowing pus and other material to escape into your abdomen. This is a very serious condition and requires immediate medical attention.
Clinical manifestations. Pain in the left iliac fossa, fever, splenomegaly between 10 and 25% of the cases, jaundice. This is more frequent in presence of liver abscesses.
Many cases of diverticulitis tend to be mild in the sense the patient can be seen by a physician as an outpatient, evaluated, diagnosis established, and be treated with antibiotics. The specific way to make the diagnosis is not only clinical presentation and clinical findings, is the need to do an X-ray, a CT scan with contrast of the abdomen, focusing in the area where the pain is present. Now, that doesn't mean that you cannot have diverticulitis in other segments of the colon. It could be at the right side, it could be the mid-portion colon, transverse colon. But as I said previously, the left side of the colon, the sigmoid colon, is the predominant site where diverticulitis develops. But abdominal pain is a broad symptom. It's caused by many conditions. So it's important for the physician to know how to proceed and differentiate what we call establish a differential diagnosis for other conditions. It could be a catastrophe, something is leaking into the abdomen. There could be another abscess. There could be a perforated appendix, and so on. So that's why prompt evaluation, proper X-ray studies, and laboratory studies as well, and then proceed with the treatment and follow.
Diagnosis. It requires the demonstration of portal vein thrombosis, accompanied by bacteremia in febrile patients. The diagnosis is frequently delayed because it is an uncommon condition with non-specific symptoms. Specific diagnostic tests. We have blood cultures, imaging studies, computerized tomography, and ultrasound.
In 10 to 25% of cases, diverticulosis precedes a similar condition called diverticulitis. This disorder occurs when diverticula become inflamed. Let's take a look at some of the possible causes of diverticulosis. Although conclusive evidence is lacking, it appears diverticulosis may result from the lack of fiber in the patient's diet. Researchers have noticed that diverticular diseases became much more prevalent in the U.S. early in the 20th century when processed foods became more common. Processed foods generally have less fiber. The more processed foods you eat, the less fiber you get. Diverticular disease is also more common in developed or industrialized countries, which adds credence to the theory that low-fiber diets promote diverticulosis and diverticulitis. Diverticular disease is rare in Asia and Africa, where people generally eat a lot more fiber.
Treatment. Antibiotics are given until there is significant clinical response, usually about 3 to 4 weeks. The antibiotic course can be complete with oral agents such as the combination of oral metronidazole and fluoroquinolone. Pros and cons. Pros. Antibiotics constitute the major treatment approach to Pylephlebitis. Cons. It is suggested not to treating most patients with anticoagulation unless there is evidence of progression of thrombosis or continued fever or bacteremia despite antibiotic therapy.
Surgery for complicated diverticulitis, another lesson learned from the past. A 53-year-old male with no relevant history came to the emergency room claiming that he had been suffering from abdominal pain for the last 15 days. It was located mostly at the lower abdomen, and in the last few days the patient had developed a fever. Physical examination revealed tenderness and pain at the left lower abdomen, and the laboratory results were 9.9 by 10 to the third power cube millimeters WBC with an RCP of 14 milligrams per deciliter. A CT scan was ordered, and a thickened sigmoid colon with several diverticula was found. This was accompanied by a bilobar collection smaller than 5 centimeters that was in contact with a portion of small bowel, also inflamed. No free liquid or pneumoperitoneum was found. The patient was admitted to the hospital and underwent conservative therapy with close follow-up. The clinical course was favorable and he was discharged. 1 month later, while awaiting a colonoscopy, the acute diverticulitis relapsed twice, requiring readmission. Once again, antibiotics and nutritional support were administered. The CT scan revealed similar findings to those of the previous episode. A sigmoidoscopy was carried out. There were no mucosal lesions, and a biopsy ruled out IBD. Laparoscopic surgical treatment was provided, as this was a complicated case of acute diverticulitis with various readmissions in a short period of time.
Issue in Ecuador. Diverticulitis is less common in vegetarians because vegetables and fruits are an important source of fiber. Obesity will be a risk factor under 40 years. Lack of exercise may also be a risk factor for developing this disease. In our country, most of the cases of lower gastrointestinal bleeding by diverticulitis are related to cases of chronic constipation.
So the first thing you can do is eat more fiber. And as you probably know, fiber is an essential part of a healthy diet. It helps rid the body of bulk waste that can get caught in the diverticula, and that can trigger the attack that we're talking about today. Many doctors and healthcare professionals recommend a gradual increase in fiber. So don't just go, loading up on fiber right away. Gradually increase your fiber intake. That'll help avoid abdominal issues, digestive distress, gas, bloating, etc. The second way you can prevent diverticulitis attacks is to increase your water intake. And staying hydrated is important for everyone. It's especially important for people who tend to suffer from digestive issues. exercise is essential for so many health benefits and improved overall well-being.
Conclusion. Pylephlebitis is an uncommon complication of an intra-abdominal infection. Due to the high mortality rate, there should be a high clinical suspicion for patients who present signs of abdominal sepsis and have non-specific lab findings after other etiologies have been excluded. The treatment is aggressive antibiotic therapy, and the use of anticoagulation therapy continues to be debated. Mortality has decreased to 25% in recent years through earlier diagnosis with imaging and appropriate therapy. Thank you.